Welcome everybody to this series of lectures on ethical implication of AI. My name is Roberto Zicari. I'm quite pleased to be introducing myself today as a speaker. I think we had a fantastic series of lectures until now, covering a number of issues from philosophy down to some of the machine learning. And what I would like to present today is some of the results of work we have been conducting in the last year. Is called Z-inspection, a holistic and analytic process to assess ethical AI. This work is done in cooperation. We have a big team. I'm very grateful that we can work together with a number of qualified people and talented people. As you can see from the list of people, from the affiliation list, you might imagine that this is really a team that is covering a number of disciplines and backgrounds. And one of the reasons is that assessing the ethical implication of an AI product or service really requires a lot of different skills and expertise. So we're really grateful that we have assembled such a great team of people. Before I start, I'd like to reconnect to one of the slides I've used in my opening lecture. When we talk about ethics, we really need to always consider what is the view of the world we are considering. In our work, at least in the way that we are conducted so far, we are taking the view of a contemporary Western European democracy based on fundamental values. As I repeat what Professor Hodges was actually mentioning, the essence of a modern democracy is based on respect for others, expressed through support for fundamental human rights. This is quite important when we start talking about an assessment that is trying to help decision maker make decision whether using a particular AI tool or service is good or bad. So let me just give you an overview of the things that we learned until now. And we start with the motivation. I took on purpose a quote from one of our speakers. It was actually speaker number 3. So Professor Rafael Calvo, he wrote a paper with a couple of co-authors and basically said ethical impact evaluation, which is basically what we are doing, involves evaluating the ethical impacts of a technology use, not just on its user, but often also on those undirectly affected, such as their friends and families, communities, society as a whole, and the planet. I like this as a motivation, because really when we are assessing an AI product or service, we really have to look at the whole picture and not only specifically at the technology. This could be a quote for any kind of technology. It works very well for AI as well. I would like to give you some idea of the methodology that we have developed. By the way, all photos are mine. Our methodology is integrating 2 approaches. A holistic approach to try grasping the whole without consideration of the various parts, and an analytic approach to consider each part of the problem domain. So trying to combine them together, sometimes zooming out, zooming in. That makes our approach quite unique, I believe. The combination of the 2 is what makes our approach quite unique. The idea is to develop an inspection that is general, but can be then apply and specify for domains of different kinds, businesses, healthcare, public sectors, etc. It uses applied ethics, and to the best of our knowledge, is the first process that combines the 2 approaches to assess an ethical AI in practice. How did we do that? Since there was not really anything already done, is really a new territory. We just did it learning by doing. We try to create an assessment that is general, but we also work on a specific use case in the area of AI-based medical devices for enhancing decision-making. By assessing a real product, we were able to grasp the issues, the difficulties, and try to come up with a general approach that could be used for other use cases in the same domain, and we will then move forward in other domains and see what are the differences between domains. So you could think of that as like an orchestration process. So the core idea of our assessment is to create an orchestration process to help teams of skilled experts to assess three things: the ethical, the technical, and legal implication of the use of an AI product or service within a given context. Wherever possible, we would like to allow to use existing frameworks, checklists, plug in existing tools to perform specific parts of the verification. So the goal is to customize the assessment process for AI deploy in different domains in different contexts. I see that as like a music director that is conducting an orchestra. The orchestra is skillful people. Each of them is probably the top in his own domain. And the director is coordinating in order to come up with a nice piece of music. Well, here the difference is that there is not already written the music, so we are creating the music ourselves. So you might ask yourself, why doing an ethical inspection? We developed the Z inspection process with the following goals in mind. One, help the decision-making process to assess if the use of AI in a given context is appropriate. Two, help minimizing risk versus identifying chances associated with AI in a given context. Three, help establishing trust in AI. We had the last lecture exactly on trust. Help improving the design of AI from a social, legal, technical viewpoint. You see, it's not only technical, it's not only social, it's not only legal, it's a combination. The last point is more a wish, is to help foster ethical values and ethical action and stimulate some kind of innovation. The last point is quite difficult because you will need incentive and a legal framework for sustaining ethical innovation. Who are the stakeholders? Well, the assessment process that we propose can be used by a variety of AI stakeholders. When we talk about stakeholders of AI, the list is very long: designers and engineers, organization, corporate bodies, policymakers and regulators, researchers, NGOs and civil society, users, general public, marginalized groups, journalists and communicators. In most cases in the literature, the last part, like marginalized groups, are not really mentioned as people have a way of saying. And the general public, to involve general public in decision where complex technology is playing a role, is actually an interesting challenge. So we're seeing this process as a design process and also what we call an ethical maintenance. So as a design process, it could be helping embedding ethics by design. If we have the opportunity to work with a team of people that are designing and implementing an AI system. But it could also be used as an ethical maintenance. We coined this word, ethical maintenance. If the AI has already been designed and deployed, it can be used to do an ethical sanity check over time, so that certain ethical standards of care are achieved. Interesting thing is there are no ethical standards at the moment. Maybe there will never be standards in ethics, but certainly there's a discussion about proposing standards that are trying to qualify if an AI is a low risk or high risk. So these are the two parts that could be used. It could be design and not yet deploy. It could be deploy, or it could be in the early phase of designing. Well, what is behind that? We call it this like a mindful use of AI. You probably never heard about it, but I think really the message is that we really believe that we are responsible and that the individual and the collective conscience is the existential place where the most significant things happen. This obviously has nothing to do with AI, is a general belief. But with our inspection, we would like to make a small contribution to help establishing what we call a mindful use of AI. If you actually agree with that and you want to share this hashtag, maybe we can start moving on that. I believe that I like to spend quite a bit of time on preconditions, because most of the time they are not really discussed. You know, when somebody is proposing a framework, either in software or in policy making a framework. But I think there are important questions to be asked and addressed before we start any kind of assessment, and in particular, if we assess an AI. And here are the questions. Who requested the inspection? At the moment, it's not mandatory, so it's a very important question is who requested and why carry out an inspection? What are the real motivation for that? And for whom is the inspection relevant? Is it recommended or required? Mandatory inspection will probably come in the future, especially in Europe. I gather that in a couple of years' time from now, we will have a law requires some kind of certification. But for the moment, there is a gap between what the law prescribes and what the practice in the market is. What are the sufficient versus necessary conditions that need to be analyzed? And how to use the result in the inspection? Well, of course, there are different possible use of the results of an inspection, verification, or certification that you can use, and sanction if we discover something illegal. A further important issue that need to be clarified upfront, if the results will be shared publicly or kept private. Of course, you know, the intellectual property is playing a role here, but in the latter case, so if somebody says, I want to keep it private, the key question is why keeping it private? This is obviously an issue related to the definition of intellectual property, and I will discuss it later on. Suppose that we have answered most of these questions, and we would like to start assessing. So that means that we need to create a team of skillful experts of different disciplines that are commissioned or are interested in doing this work. Well, we should also double check if, number one, there are no conflict of interest between, let's call it the inspector, and the entity organization to be examined. I think it's a very important point that really rules out self-assessment. I don't mean that self-assessment is a bad thing, but self-assessment, so people that within the same organization are commissioned to do an ethical inspection, is likely to be bound to conflict of interest, willingly or not. But also, we should ensure that no conflict of interest exists between the inspector and vendors of tool and toolkits or framework to be used in the inspection. So there's a bunch of company vendors proposing solution, tools, and vendors, and there should be no conflict of interest. And the third, which is also quite important, that we should assess potential bias of the team of inspectors. I'll talk about that later on. It is a go if all the three above are satisfied. Still go, we restrict the use of specific tool if the tool is not satisfied. It's certainly no go if one or three are not satisfied. This is our belief. You know, there might be a different situation in the market, but it's really important that an organization or whoever does it should have an independent state. important is to consider that AI is not AI, it's AI in the context. So when we look at the AI, we look at not only the single element, it's not in isolation, it's really dependent on the domain where the AI is deployed, and it's part of one or more what we call digital ecosystems. You know, spaces where the AI is designed, deployed, or used. I'll talk about later on that. And obviously AI is part of processes, people, products, services, and it has to do with data. So it's not a box, it's just part of an entire ecosystem or ecosystems. The boundary of the inspection are important. So what you want to assess is something that has to be defined upfront. We call ecosystem, and our definition of ecosystem generalizes the notion of sectors and parts of society defined in one. So it's not only sectors and parts of society, level of social organization, and the stakeholders, but we also had the political economic dimension on that. You'll see that because we're still in the precondition, but the precondition are normally not technical, but really challenging, also because of the raising important issues. The German Data Ethics Commission has basically defined what they call a socio-technical systems, which is very similar to what we call ecosystems. They said the assessment, if you do an assessment, depends on the entire social technical system, that is, all components of an algorithmic application, including all human actors, from the development phase to implementation in application environment and the phase of evaluation and correction. This is basically, let me just switch off some microphone. Okay.
Mi può cambiare per il carrello? Ah, grazie.
All right, so I mute. So this is basically a recommendation of the German Data Ethics Commission that is really in line to what we call also ecosystems. We look last lecture at the issue of trust. This is very important. AI, context, and trust. So trust between humans and AI is not something like monolithic. It's really depending on the context. There often existing variety degrees of trust, and the level of trust sufficient to deploy AI in different contexts is therefore an important question for evaluation. That's very important because there's some kind of suggestion that says we could certify AI by level of risk. I didn't mention at the beginning of the talk, but I will probably look at the chat at a certain point and ask some of the questions in the middle and at the end. So if we look at the, move forward and we look at AI, the context, trust, embedded into ethics and democracy. So from a Western perspective, the terms context, trust, and ethics are closely related to our concept of democracy. I'm quoting what the German Data Ethics Commission recommended in a recent report. They were talking about algorithmics. They also included AI. Need of examination of the extent to which the function of the system can affect the function of democracy, fundamental rights, secondary law, or the basic rules of the rule of law. This is very important. They're really looking at whatever you do with technology, you shouldn't endanger democracy, fundamental rights, secondary law, or the basic rule of the law. So I know that this is going to be subject of discussion, and you will very rarely see scientists or people looking at trustful AI considering this, this issue, but I think it's important that we ask ourselves, what if the ecosystems that we are considering are not democratic? If we assume that the definition of the boundaries of ecosystem is part of our inspection process, then the key question that needs to be answered before starting any assessment is the following. Do we want to assess if the ecosystem or ecosystems where the AI has been designed, produced, or used is democratic? Should this be part of an ethical assessment or not? Each of you will probably have an opinion. Our opinion is yes. And if that will be the case, then the assessment will also look at the origin or the destination of the AI from a completely different perspective than simply the technical one. So, as a political and institutional context, we therefore recommend that the decision-making process as to whether and where AI-based products and services should be used must include, as an integral part, the political assessment of the democracy of the ecosystem that define the context. Responsible use of AI inherit properties from the wider political and institutional context. We certainly understand that this could be a very debatable point, but I think it's important that, you know, we all have an opinion, and if you will be somebody in a position to be a decision maker or contributing to the decision-making process, I think it's important that you address this question as well. The second part, we're still in the precondition. The second aspect that should be considered that AI could consolidate the concentration of power. I quote again the German Data Ethics Commission that are talking about, in general, the development of the data economy. Since AI is based on data, so it fits very well. They said the development of the data economy is accompanied by economic concentration tendencies that allow the emergence of new power imbalances to be observed. That's the first statement. Second statement, efforts to secure digital sovereignty in the long term are therefore not only a requirement of political foresights, but also an expression of ethical responsibility. This is really where the second question we should pose is, should this be part of the assessment? Again, here is debatable, the obviously different interests, but I think the answer that we have is yes. And that reflects also on the areas of investigation indicator if you wish to assess. Another interesting aspect that we call it embedded ethics into AI. When designing, training, and testing an AI system, for example, a machine learning algorithm, in fact, we do embed into the system notions such as good, bad, healthy, disease, mostly not in an explicit way. I like to quote one of our speakers that, by the way, I saw is attending our lecture here, which is basically Thomas Groth and his colleague, and he's basically giving an example of embedding ethics into medical diagnosis. The quote is the following: in case of medical diagnosis or treatment recommendation, we'll see that we are really assessing our use cases really on medical diagnosis, are being deferred to machine learning algorithm. It is the algorithm who sets the bar about how a disease is being defined. It's a very interesting observation. It goes on, and since Thomas is a philosopher as a background, which is quite nice for us because we can link it to the entire course, he said the deployment of machine learning in medicine my research, a debate between philosophers, between what is called naturalists and normativists. Since I don't expect that everybody understands what this means, I kept quoting Thomas and his colleague, and let me read it to you. In the philosophy of medicine, the status of concepts such as health and disease is heavily contested. And there are basically two camps, naturalists and normativists. Naturalists assume that these concepts are value-free representation of the world. For instance, according to Christopher Bohr's influential account, disease might be conceived as a biological dysfunction. So you don't do much about it. But normatives assume that disease is a value-laden concept mostly employed by practical purposes, such as deciding who should get medical treatment. Very important, how you define disease could lead to resources, could lead to discrimination if you don't get the resources, could lead to a wrong assumption of a disease. So if you leave it to a machine, you basically leave it to the designer that had his own idea about good or bad. Good or bad, we talk about it in the example of self-driving cars in my introductory lecture. And health, we will see in our use case, we have an example, and Thomas Croton in his lecture also covered that point. When you're assessing something, one possibility is to provide some scores or labeling. For example, one could come up with AI ethics scores or labeling. We use the word scoring to denote the assignment of a numerical value, a score, to an AI-based software for the purpose of evaluating certain areas of investigation. This is very important. You don't score the entire AI. You score certain features of the AI or certain areas that you pretend to investigate. For example, fairness. Is the AI or the, let's say, the algorithm that is proposed by the AI fair, or discrimination? And then you can go on, because the list of investigation is really a key concept that is really dependent on who has their way of saying about what to investigate. The scoring might have different meaning depending on when and why they're used. You can do a scoring before any AI is deployed. And this could be static, and it could be like a certification. You put a label like green, red, yellow, and this will mean that this AI has certain level of risk, probably related to a number of indicators. Possible, there's some proposal around. Nothing has been already implemented because there is no law and there is no a certification process in place. And I never seen anybody talking about doing an ethical inspection afterwards, where the scoring and labeling is evolving over time. This is something that in real life, for example, when you have a car, you are supposed to give the car for inspection, at least here in Germany, once a year, and get an approval that certain functions of the car have been checked, evaluated, and they are passing a certain level of validation. So maybe this could be one thing that will happen as well. The design of a scoring system requires certain design question. What are the areas of investigation? So which indicator should be included in the score and which one should be excluded? And here is very important that we understand that there is already at this point an important decision to be made. For example, if you want to include as an indicator concentration of power, democracy of the boundaries of the investigation, or if you want to restrict your attention only to technical issues. This is a very important consideration because it will make the validation completely different. Then which criteria, which quality criteria should the score meet? Which element of the score should be known and which should be transparent and comprehensible, and which should not? See, we talk about transparency, and transparency is not only about the AI, but it's also about the process that is assessing the AI. For example, when you bring your car for inspection, you know what are the elements that the inspection has checked. Maybe the brake, maybe the lights, maybe certain function, and you have a checklist. You can probably ask for questions, so you get an explanation. Now, whether you understand the explanation is another story, because it really depends on your knowledge and what kind of explanation you get. And what is the time frame for scoring? Is it static or dynamic? You score once and then you forget about it, or you keep on scoring. It would be quite nice to create a positive scoring scale, fostering ethical values where there is no negative and is only positive. So something like trade fair. You can decide to buy coffee, the fair trade, or you can buy any coffee. So, and when you buy fair trade coffee, you know that there's been a process assessing the supply chain from initial to delivery, and certain quality that you think are important are assessed and validated. Now here in this case, you have to go beyond the delivery and look also what happened afterwards. So it would be amazing to have a scoring system that is supporting ethical principle. Core ethical principle would be common good or well-being. But the problem is that these concepts are not well defined even in the Western world. So you can start already discussing among philosophy or applied philosophy the concept. And then you really need further refinement. Anyway, what to do with the output of this investigation? You can provide feedback to the designer and developers, if this is possible. Help them to improve, change the AI, the model, the data, the training, or the deployment of the AI in the context. That's what we did in our use case, because we have access to the designer. But in most cases, this should not be possible. In most cases, you will have an AI already designed, deploy, and basically give feedback to decision maker to help them decide how and when to use or not the AI, given certain constraint, requirement, and ethical reasoning. This will be very likely the case in most of the time. And this will be part of the engineering practice. So we try to close a gap, and this was actually mentioned in this report that I mentioned in my opening lecture. The real challenge is recognizing and navigating the tension between principle that will arise in practice. I think we are really getting close to the second and the fourth lecture of Emmanuel Goffi was talking about high-level ethical and philosophical principle. But when you get into the practice, you need to look at the practical tension and find a solution. I recall the tension for us, as defined in the report to the NAFI Foundation, is basically when values are in conflict. Specifically, tension between the pursuit of different values in technological application rather than an abstract tension between the values themselves. Okay, so what we do is we classify AI system, model, and data in 4 categories. The first one here is basically we have access to everything. So we're part of the team that is basically designing the AI. So that means that we have access to the design, the model, the training data, test data, input data, and every other actors that are relevant here. So this is if you're part of a lab or you're part of the company and you're working on producing a new product, a new service. And then you go down up to this level where you really have a black box. Somebody has delivered to you an AI, has been produced and designed. You have access to basically only the box, if it's a box. No access to model, training, test data, input, design. You have no idea who was involved. And of course, in the middle, you have 2 variations. can understand that the decision on verifying if a use of AI is good or bad is quite different if you're here and if you are here. I think in most of the cases, we will be in this case where a policymaker or stakeholders that not necessarily have a technical background, they need to make decisions with very little information. Remember the embedded ethics? This is contained always in embedded ethics because somebody has designed it with some threshold. What is good, what is bad, what is healthy, what is unhealthy, what is risk, what is not risk. When you look at an assessment of any kind, and in particular of AI, it's important to consider intellectual property. First of all, the important thing is to clarify what is and how to handle intellectual property. And what restriction intellectual property pose to an assessment. You might think, oh, well, do I need to do code reviews? Meaning I go and look at how the machine learning classifier has been implemented. Well, not necessarily always possible or needed. But then if it's possible, then you need to figure it out. What are the conditions? Very likely, you will not be able to review the code unless you sign a non-disclosure agreement. That's what we did with this company, which is actually posing a very important issue when you want to disclose the results of this assessment. So intellectual property and transparency don't really go very well along. And if the assessment is meant to be public, it's probably an important issue to consider upfront before you even start doing anything. The implication, there is a trade-off between disclosing your activity in public or keeping it because you have signed an NDA. Now, this is very subtle because there's been a recent letter published by a number of medical scientists mentioning that Google published a paper in Nature claiming their artificial intelligence system outperforms human radiologists, which is great. So probably a very good thing. Unfortunately, they do not provide the code or the data that backups this claim, arguing that they're doing so is not feasible and claiming that others can reproduce it without code. Now, it's interesting, not feasible for me is very similar to, well, there's some secrets. And the letter continued describing the problem for science brought about this failure to make computational method transparent and reproducible. So this is the paper here. There's a discussion ongoing also in the scientific community. So our inspection is covering three areas: ethical, technical, and legal. As we discussed already, legal and ethical are not the same thing. You can do things that are perfectly legal and not ethical at all. You can be a successful business and not necessarily be in the top best practice in ethical. And of course, this is all dependent on where you are, in which view of the world, in which ecosystems. We basically follow the recommendation of the AU high-level expert group, which presents trustworthy artificial intelligence, as Christopher Burr was referring to in his presentation as well. And basically, in this presentation, they refer to three elements: lawful, respective from applicable laws and regulation; ethical, respective to ethical principle and value; and robust, from a technical perspective, and more difficult on the social environment. So we have a layer model that we developed recently. It goes from the bottom here to the top. The bottom is all the legal and regulatory level that are there. This level is what the company has contractual obligation. So this is the law of the country or the ecosystem where you are. These are contractual obligations that the entity has, very likely based on the law and regulation. This is the layer of our inspection. And these are the ethical principles and that are commonly understood in this area. So we have a little description on that. For example, in the level of legal and regulatory, you could, for example, have in Europe the GDPR, which is a recent law about data protection. So if you're doing any kind of activity within this space as a specific law. Now, on top of that, you could have a layer of obligation and duties and rights that your institution have, and then has to be respected as a private or public institution. And this is our layer where we are basically, for the moment, working on creating an assessment, which is not legally binding at the moment because there is not a legal requirements and there's no certification in place. And on top of that, we have a level where philosopher and researcher do agree on what are the ethical principles that should be evaluated. The ethical principles that we use are the one that also Christopher Berg was mentioning. The EU has come up with 4. The 3 are the ones that are normally classical in medical and bioethics. And explainability is the one that was introduced specifically for AI. And remembering that all of these principles could probably end up having tension between them. And resolve tension is one of the things. The EU is working on requirements, and they have 7 requirements that are listed here. Human agency and oversight, technical robustness, safety, privacy and data governance, transparencies, diversity, non-discrimination, fairness, societal, environmental well-being, accountability. And there's a pilot checklist where they try to define some of the key questions. What we did is we consider some of those and we clustered them together, also suggested in some way by the NAFTA Foundation, and we clustered in areas that we call areas of investigation. The first area of investigation is this one here. We cluster bias, fairness, and discrimination together. The second is transparency, which sometimes comes with variation of explainability, intelligibility, interoperability. Please consider that transparency is not the same as explainability. So I can explain something, although I don't show anything, or I can show something and don't explain anything. So there are 2 facets of the same thing: privacy, responsibility, accountability, safety, human in the loop. And here, looking at the literature, there's a list of other indicators, and there's not an agreement on all of them. For example, here, avoid concentration of power. This is not something that everybody agrees. There's a reason why they don't agree, because obviously there should be a definition of what concentration of power means, in which context, and how it is used. Upholding human rights and values is very important. And legal and policy implication is also important, and contemplation of implication for employment. So this is in the literature. These are all the indicators that are being proposed. Now the question is, what do I want to assess? I can be strictly technical, or I can go in an area that is certainly not technical and try to understand what comes out. Accountability has to do with risk, for example. Who is responsible? So how do we work? And you now recognize that what you also been looking in the previous lecture is something we use in practice. We use socio-technical scenario to describe the aim of an AI system, the actor and the expectation. And basically, a team of experts play around with several scenarios to try to identify possible, what we call ethical issues. And we mark them. So these are issues that could potentially be ethical issue challenges that are something that requires some attention. In the process of doing that, we also use the concept of concept building, as suggested by Witherspoon and colleagues, mapping and clarifying ambiguities, bridging discipline sector, public and culture, building consensus and managing disagreements. This is an iterative process that we do among the experts of our team that have different skills and different terminology and different background, and make them to talk to each other is already one of the goals of concept building. Because then you need to solve terminology overlaps. We discussed in the opening lecture difference between discipline, and we have difference between discipline in our team, and also between culture and stakeholders. Once we have identified some of the key concepts that need to be looked at, the second phase is to develop an evidence base. What has already been proven to be studied in this domain that has to do with this particular application of an AI. Basically, this is again an iterative process among experts with different skill and background. And the interesting thing at the beginning, that's our experience, maybe it was very naive. I thought it was straightforward. You have a number of people with different background, they all agree what is evident. And we discovered something very interesting, that building an evidence base is already a issue, a process per se. Because, for example, in medicine, if you look at some of the discussions that occur in cardiology, for example, and versus evidence-based medicine, so public health, where the view of public health is that probably cardiologists are biased in any way, and the cardiologist is not going to be in the position to do a proper assessment of something related to cardiovascular disease. I was actually astounded by this discovery, because in my naive assumption was, okay, we have a product that is a classifier for predicting risk of a heart attack, and we need cardiologists to evaluate this product. But then we included in our team an expert in public health that basically told us that there's a big debate in the medical space about who is supposed to give medical evidence. So now this was a specific of medicine, but when you want to create evidence, an evidence base, it's already an ethical process per se, because this is really where you try to anchor yourself with facts, peer review, publication, and this is really where you try to understand what is already known in the area. Once you have that, and you analyze that, you need to identify, classify, and describe tension, if there are. This is, again, an iterative process, because when different experts come up with tension, they describe it differently. They mean different things, and to classify them is a process per se. The cardiology means something different than somebody who has done due diligence, or public health, or somebody who has done clinical trials in the pharmaceutical industry, or somebody who has done software engineering. So to move them into a frame where these are some of the examples of tension that were taken by the paper from Nuffield, accuracy versus fairness. You can have a long list. Important that the long list should be described. What do you mean with that? What do you mean with accuracy versus fairness? Do we have that kind of situation? And if yes, why? This is a process. And once the assessment team has come up with a list of tensions, it will be important to understand if we can classify them as real true dilemma, or anything that can be solved, like in this case, or depending on the constraints we have, even if there will be a solution, there's not capacity to find a solution. And that will be very important in practice, because you don't want to have an assessment that lasts 3 years and it costs €1 million or $1 million, but at the same time, you need to do a proper assessment. And somebody has to make a decision. So a trade-off, shall I use it? Shall I not use it? If yes, in which context? or shall I a priori decide that we shouldn't use any kind of this system in this kind of domain. So the output of this phase of the assessment is basically a list of what we call ethical issues and flags. So you might wonder, what are flags? Well, an ethical issues or tension we discuss is differences in values that can be in conflict. And the experts have understood that there are ethical tension. But sometimes it's not that white and black. Sometimes you have an issue, but you don't know exactly what it is. It could be ethical, it could be technical, it could be policymaker, it could be legal, but it's not clear, so we call it flag. A flag is an issue that doesn't seem to be right and need to be assessed further. It could be a potential ethical tension, and or policy issue, or technical issue, or a legal issue, or any combination of those. And this is a result of an iterative process based on common understanding of the scenario, which is like concept building means, by whom is analyzed them. Already, the selection of who is expert to analyze is already ethical, because really that's the key on that. Once we have that, what do? Well, we have this principle, remember the ethical principle, the requirement, the area of investigation. How do I map them together? Well, we come up with the process again, which is done in several steps. I have no time to go through the steps, but there are several mapping steps, and it's a several iteration, which basically try to map the issue and the flags that we have identified to specific areas of investigation. For example, it has to do with bias and fairness. It has to do with accountability. It has to do with security. And we discovered that the choice of who is in charge of doing this mapping and also the analysis has an ethical and practical implication. That's why it's so important, the precondition that we set at the beginning, because if the team is biased for any reason, then the results will be biased. You see, it's not only the AI that produces a biased result, and this is really happening. I don't know if you follow last year, a large tech company, very big, using a lot of data, decided to create an ethical board, and they publish it nicely. They put in the board a nice mix of very famous academics and industry people. And after less than a month, the board was dissolved because there were controversy that some of the people in the board were biased with political or industrial interest. And that was gone. And that tells you how difficult it is to self-regulate within the same organization. So it's quite difficult to be able to be, at the same time, the leader and the controller. Okay, let's go somehow a bit more specific. Once we have identified that, the question is, what is the boundary? How do I work? And we have come up with a macro and the micro investigation at possibility. The macro is this one here. Suppose that somebody has defined or developed an AI system, and this AI system is in the ecosystem here. Then this has been embedded here in another ecosystem, and we may be part of processes with people. And this and maybe some data is stored back here in the cloud, and the results of this is used in another ecosystem by some decision makers to make some kind of decision. As you can see there, that's a big picture, because if you want to analyze this AI, you need to start looking at all the places where the AI has some kind of relevance. That's called macro investigation. One can look at the so-called micro investigation, where you really look only at the AI within the context of a specific, could be a company, could be an organization, and you check, depending on some values, and you only check the specific AI in the tiny context. Now, the interesting thing is, you do that, and you even put the stamp ethically check, it doesn't mean at all that the rest of the macro system is ethically checked. And if this has an input here or here, maybe this is perfectly ethically checked here, but this doesn't work very well here. Now, what you will wonder and say, oh, okay, but if I buy a car and I done a safety check, the car is perfectly fine, so it's been safety check, and then I'm using it, and unfortunately I use it in an improper way, and I create an accident because I was driving under alcohol. This is obviously not ethical, but there's nothing to do with this ethical check. Now, I would wish that in AI, this will be not the case, because otherwise you're limiting responsibility to say, well, this is working, but what you do is your business. I think we're all connected. So this is the producer, this is the validator, and this is, again, the user. Everybody is kind of responsible. But it would be difficult to come up with laws and certification. We have a concept of layers. A layer is a subset of the boundary of the inspection, considered a certain level of abstraction, macro or micro. And each level of abstraction is a layer. And the number of layers might be created for a given boundary. So it sounds a bit strange, but the way we do it, at a certain point, a bit like due diligence, if you wish, we want to create what we call path. A path is addressing some ethical issues and some flag that have been associated to a cluster area of investigation. For example, these issues here have something to do with bias, fairness, and discrimination. And the path is composed of a number of steps to assess the ethical tension and the flag related to this area. So you will wonder, okay, what is an execution of this path? Well, this is not software. This corresponds to the execution of steps by people, and people can use in various ways. A step of a path is executed in the context of one or more layers at different level of abstraction. And the execution is performed in a variety of ways. It could be workshop, interview, checking and running questionnaire and checklist, applying software tools, measuring value, semi-automatic, automatic. But at the end of the day, is a validation done by a number of people. So a path describes the dynamic of the inspection. It is different case by case. And possibly, if you have a log mechanism in place, which is registering everything you do, you can trace it back and explain it. Very important if you want to have the inspection being explainable and shared. And it can be, parts of the path can be executed by different teams with different expertise. Sounds abstract, but take this example. You take a path which has been associated with fairness, and you go deep into validating things like the training data, and then you discover that you don't really trust neither the training data, you don't even trust the people that design the system, you don't even trust the labeler. And basically what you end up discovering that you are not even trusting the platform where the system was developed. And this goes to another path, maybe with other people that are more looking at security. Well, security can be audited in different ways. And this could give a feedback back to this path that could help the definition of fairness, and eventually maybe this thing can pass information to the team that is supposed to give a validation of explainability. Just as a abstract example. I like the idea of looking for paths like water finds its way. Water always finds its way unless there's a block. A block is also a very interesting concept. Something blocking water flow, then maybe there is something unethical there, or maybe it's something totally good. And it's case by case. You can start with a predefined set of paths. So you say, okay, I want to assess fairness first. then I want to assess explainability second, third, and then I look at the ethical issue, or I just start random and discover what I discover analyzing the scenario. What is interesting is also looking at what is not there. Why things are not done sometimes is an interesting observation why this is not being done, why there is not an explanation, or why this is not being communicated, or why this information has been withheld. And because it gives you a very interesting starting point for investigating. It's a very classical technique in investigation in general, looking what is missing. We come up with inspection methodology. One is bottom-up. You go from a micro to a macro investigation, from tiny to big. Top-down is the other way around. You start with the big picture and you dip down into the micro. The inside out is you start at a certain level of abstraction that somebody is fixing, and then you navigate at the same level of abstraction, expanding. The typical example, if you drop a oil in a cup of coffee, the oil will basically, first of all, will not go down, but it will stay on the surface. So that's the level where you are. That's the level of abstraction. And then it will increase space. If you drop oil on your shirt, you'll notice that the oil will stay on the surface, but will start expanding inside out. And the mix is basically you mix all of that just to have paths that go higher level abstraction, lower level abstraction, same level of abstraction, but different parts of the ecosystem. So it could, it could be a jungle of things. And how to start? Well, it depends on the team. It depends on the domain, on the situation. You could start small and going big, or you can start at a certain level and go inside out. And basically, there is no prescription except that you need to be able to start with something. This would be, for example, an inside out. So you take a level of abstraction. The AI is part of some kind of processes and people, and you start analyzing what's nearby. So it's not only the input and the output and the model, but also who's using it, why they're using it, what do they do with that, and then if necessary, you can go deeper if you want to assess certain technical feature, but you can go higher and see the big picture here, for example. And it's an iterative approach. You see, this is basically, if this is the level of abstraction where you start, and you might actually go deeper to code or to the boundary of your assessment. And it could be for several of the features that we want to investigate. And so basically, it's like a cake that you slice it and you go inside, but you also see the big picture. And you iterate and iterate, and some of the path can give feedback to each other so that you are able to coordinate the team, and eventually you stop. Now, when to stop is a very interesting question that nobody has ever come up with a solution. So how to stop really depends on what you want to investigate, how much time you have, how much resources, what budget you have, and what are the things that are important and what are not. So that's really an important point. If you stop too early, you don't expect enough. If you drag it along, then it doesn't make any sense, and nobody's going to use it. This is some of the things that you could do when you do an inspection, and there are plenty of researchers and people working on verifying some of these things. These are very technical, for example. So these are the technical part of the inspection. But the other part is certainly not technical, and it has to do with making decisions about trade-off. Now, this is the first part of my talk, which is basically general. So what I could do is, before I tell you about how we experience our assessment with a real use case, I can go on the chat myself and see if there's any comments or question. I see there's a lot of questions, so bear with me. I need to scan it. Let me go backwards. I think it's easier. Okay, so let me start with Emmanuel Ray. So hello, Emmanuel. Nice to have you here. Interesting framework. Thank you. Quite comprehensive in theory and self-assessment for implementation, specific in industry. Is there a visual framework or a step-by-step guide to inspect an AI system in order to classify into the level A, B, and B plus that we mentioned? Very interesting observation. No, I didn't find anything at the moment, and it would be quite a nice idea in our framework to come up with a visual and a number of criteria that will allow companies to self-classify or let's say institutions to self-qualify the classification. This classification is not standard, so basically it's something that we discover, but I think it's a very good point. So I think it we will take into account. So thank you a lot. So let me go backwards, and I have a question from Elena Jones. Do we get macro validation upon doing enough micro validation in enough different contexts? This is really a very difficult question. First of all, it really depends on the context. If you keep on doing micro validation, you don't see the picture. So it would be like if you take a car and somebody is only looking. Well, let's take a better example. So let's assume that you take a person. It just happened. So you have specialized doctors that are extremely good in one thing. For example, a knee surgeon. He knows everything about knee, but he tends to see the knee as the main thing of a person. And then you have somebody that maybe is more holistic in the medicine space, and maybe is not an expert in one thing in particular, but he sees the connection of the two. So I think it's important that the two parts need to be complementary. For example, in medicine, this is not really the case. You know, if you have a surgery in one particular area of your body and the surgeon is top surgeon, very specialized, extremely good, it's unlikely that he's going to look at various parts of your body that might have created this particular situation. If you have an arthrosis and you need to be have a surgery on your knee, they don't ask you why. They just simply say you have it, and then they fix it. But by fixing it, it doesn't mean that it solved the problem. So I think this is a question that we will be able to answer by only working on many cases, having more people working on that, and coming up with some practical assessment about that. So I don't have a very specific question for that. Let me see. Oh, Paolo Giudici. So welcome, Paolo. He said, I think the advantage of the inspection over self-assessment is that it involves less conflict of interest. However, it might be more difficult to implement than self-assessment. Of course, of course. The idea of a self-assessment is easy to some extent because you think you have control. Now, the question is who is controlling the people making self-assessment. So, yes, obviously, an inspection like the one we are proposing either creates a positive attitude. Well, okay, a company produce incredible results, and then he can show he has an incredible ethical stand, but probably it would be necessary when by law it would be required some kind of certification, static or over time. So, but certainly you got to the point. Then there's another question from, okay, let me see the, okay. Oh, I like that. Elena Jones is asking, how would you define digital sovereignty? Which is a quote from the Data Ethics Committee, the German Data Ethics Commission. To clarify, if an algorithm is used to define disease, would that side with the naturalist? I think the digital sovereignty that the Data Ethics Commission, the German Data Ethics Commission was mentioning, it was mainly about trust, democracy, and when you rely on, let's say, platforms or ecosystems that do not conform with either law or fundamental rights principle, they were suggesting some kind of digital sovereignty, meaning choosing. And that's basically where it comes to the decision, you know, when you have a product and this product embeds some ethical values inside, and this has to be used in a hospital, and you are in one particular part of the world, somebody has to make a decision. And if, for example, this is an element of AI that has to do with information or filtering or surveillance, and then you have that kind of political, this is a pure political decision how to do it. I would like to move forward, and I will certainly ask more of the questions at the end. I reserve more time. I would like to spend the second part of the presentation on what we discovered working on a real use case. So it took us almost a year. Obviously, this is not supposed to be the length of time for an assessment, but we wanted to learn by just doing something practical. So we have been assessing for almost a year a AI-based medical device for enhancing decision-making in cardiology. I don't mention the company, but the domain, so we did the socio-technical scenario. The domain is to identify stable coronary artery disease, meaning if you have any issue with your heart, like the risk of a heart attack or something like that. Now, the gold standard of that is an invasive diagnostic, 100% accurate, called coronary angiography. You don't really want to do that unless you really need, because it requires some invasive introduction of elements in your heart. So obviously, there's been quite a bit of work in non-invasive diagnostic. I'm sure that everybody has done in his life in ECG. So, and certainly an ECG is non-invasive and is a tool for detecting certain risk, but it's not 100% accurate. So there's been work done in the 80s, which is basically called cardiosography. It's basically something that is based on so-called vector cardiography, which is basically like an ECG, only that in ECG is like a two-dimensional. You know, you look at the signals of the heart, you know, and you have a plot. And this vector cardiography is a three-dimensional analysis of the electrical signals of the heart in a three-dimensional space. It's been introduced in the 80s in Switzerland by Sanz and other colleagues, but they never really took off as a practical way of replacing ECG as a non-invasive tool. And recently, a company has come up with introducing vector cardiography using a machine learning algorithm. Is actually a weak classifier. Actually, it's an ensemble of feedback network that is basically analyzing the electrical signal of the heart by applying electrodes and basically making a prediction of the risk of a cardiovascular problem as an output. So, and they sell in that. So we have access to, we in our classification, just to answer Ilona Jones, you know, or Paolo Giudice, basically we have access to all the team, we have access to the company. So we're basically in the situation of being able to work with them. So the process is the following. They have step one, they measure electrical signal. Is a box with sensors. There are 3 sensors, 3 in the chest and 1 in the back. You collect the data, so data acquisition, signal processing. It goes into a cloud where there is a neural network classifier. Is an ensemble of 25 feedboard neural networks, and they are trained. And basically, the output is an index. And then somebody is making a decision based upon this output. Now, this is technical, but what it means in terms of the model prediction. So let's assume you're a patient, you go to a doctor, your doctor has decided to use this new tool, and he said, would you like to use it? You say, well, why not? And then you just measure the electrical signal, then the tool elaborates and comes up with a green, meaning the classifier predicts that you have a low risk of a heart attack or no risk of a heart attack. Well, what happened? You know, the doctor might agree and the patient does nothing, or the patient and or the doctor don't trust and ask for further invasive tests, or the patient receive a red or a yellow, because these are the 3 colors you get. Red, you have a high risk of cardiovascular disease. Yellow, you have a problem, but they can tell you what it is. So, and again here, there's a reaction. There's an interaction between doctors and patient, and there is no explanation, at least in the sense of something that can be clearly shown to a patient. There is an explanation that this tool has, which is transforming the 3-dimensional electrical signal into 2-dimensional signal like an ECG, so that any doctor that understands an ECG would be able to read it. Now, this is interesting because by doing that, there is no medical evidence that by going from 3-dimensional to 2-dimensional, the same information is transferred correctly to the doctor. Oh, okay. Since we have Thomas in the audience, I like to quote his work. He has done a very nice paper with his colleague Behrens, and basically we were looking for medical evidence. So, and in order to start understanding that, we said, so let's see what other people have already thought or published on that specific case. And Thomas and Groth and Behrens argue that deploying a machine learning algorithm in healthcare entails trade-off at the epistemic and the normative level, with the risk of potentially undermining the epistemic authority of clinician and possibly pitfalls with respect to paternalism, moral responsibility, and fairness. Okay, obviously, his terminology is not the one of a software engineer, but if you look at carefully, authority of clinician, very important. You'll see when we look at the trade-off, you know, who is really in charge now? Is that the tool or is a clinician? And second, what about fairness? Is this tool fair? And what about responsibility if something goes wrong? And what about if, for example, there's a bias? It's okay, well, we think that this tool is always good, and we defer the decision to something that, you know, can be explained. So, and this is important because somebody has in this tool make the assumption of the threshold. So when you train a classifier, you need to set the threshold and basically say, a loss function is called, but basically say when the classifier will basically say you have a risk of a condition. And obviously, this is inside. But for example, a patient might come to harm if the prediction is not accurate. That's very important because when you use this tool, you don't know how it was trained. We do know because we have been working with the company, even signing an NDA, but at the end of the day, accuracy is important because, does it work properly for all kinds of ethnicity or only for certain kinds of population? And that's really important because if the patient will have to make an informed decision, this is not explainable because the doctor certainly doesn't know how the tool has been trained. They might have an explanation of the signals, but not necessarily how it was done. So again, we find it quite nice continuing looking at what Thomas Grote and colleagues mentioned. As the patient is not provided with sufficient information concerning the confidence of a given diagnosis or the rationale of the treatment prediction is not our case, but the diagnosis, yes, she might not well equipped to give her consent to treatment decision. This is really important because then you start having interaction outside the AI. It has to do with whom are you talking? Is the patient talking to a doctor? Is the doctor trusting the AI, not trusting the AI? You're talking to a colleague who has already done that, or you're talking to a cardiologist who has no idea about this tool. So these are all interesting things. And building an evidence base, as again, we are quoting their work, meaning that is important because at the end of the day, clinicians are held accountable for their decision. And if they don't understand themselves what is in the tool, of course, there could be a resistance. And again, this could be maybe an interesting tool that is working perfectly well, but is not part of the usual things. Another important things that have been raised in general, and we were basically looking at that space of building evidence bases, what we call low-risk AI-based medical device. So in the classification of medical devices, the ones that are non-invasive are normally at low risk, which means that, for example, in Europe, but I think also in the States, you don't have to go through clinical trial. So you don't have to go through the rigorous test of other medical device as you will have in invasive, which basically raise risk because nobody's really doing the classical clinical trial, especially when the model change and especially when things change. You will never expect that when you go to a doctor and you have a blood test, the method for evaluating your blood values changes over time. So we basically understood that there is really a need of what we call ethical maintenance, which is basically means not only checking if this AI fulfills certain criteria, is accurate, it does not discriminate, is fair, and is explainable, but also over time, especially when the AI model is constantly updated, improve using new training data, test data, as is in the case of this tool, then it's impossible to compare prediction for the same patient over time. This is happening not only in this use case, but in many of the cases of startups in AI that are constantly improving because it's the only way to improve the accuracy, for example. But it's not really a common practice in clinical trial, in clinical testing. So, and even in this case, if you have a peer-reviewed medical evidence that is being published, but the system evolves over time, the system does not refer anymore to the medical evidence being published maybe a year ago or 2 years ago, because has changed. So this is really a very, very complicated area that requires, first of all, a filling the gap of the law, because at the moment they're changing the law now, probably making AI or let's say a algorithmic assistant device be part of the category for validation. And over time, when something changes, because normally this is, you don't change a drug, over time. When the pharmaceutical companies spend 10 years in doing all the verification, then they go on the market and they don't change the formula over time in the future. So that's really interesting. So if you look at our case, which is basically in healthcare, we had to choose context-related ethics. Well, the Western clinical medical ethics is this one here, the classical principle. Explainability is the one that is new. This one is basically, if you do that, I use the word Western here, implicitly we define an ecosystems. See, already this meaning, these values here, these ethical principles that are anchored in this Western clinical medical ethics define ecosystems, which means that where does it come, this AI, or where is deployed? It makes a lot of sense, because if it's coming from this area, then you anchor here, and you might even have laws maybe that will fulfill something, but it's coming from outside or it goes outside, this might not hold true anymore, or at least not in the sense that we understand. So what are the main findings? So when we assessed this product with several iterations, the first big ethical tension that were suggested from an ethical perspective is the assessment between the chances that more people with an undetected serious cardiovascular problem will be diagnosed in early stage, so the benefit of this tool, saving life, versus the risk of a wrong diagnosis and the cost associated of unnecessary invasive tests when there is no reason, so false positive or false negative. So this is the anchor of that. So, and then if you go more specific, and it's quite nice that we found a lot of evidence that are really, when you go back to the work of Growth and Behrens, they support it. So we actually were pleased that we first did this work and then we look at the evidence and say, oh, they match very well together. We have something that we call diagnostic trust and competence. When this AI tool is being used in screening asymptomatic patients, so patients who have no symptom, and they are notified by the AI with a minor problem, for example, maybe a yellow, they might really not significantly do anything particular, but they might get worried, change their lifestyle after the notification, although this will not be necessary. Maybe they don't even go to the doctor, but this is creating anxiety, and it has an impact on people if they trust this. If they distrust it, they may get even upset that they try the test anyway. So this is a one interesting issue. But the other one is, if this app or this AI tests more patients with minor cardiovascular problems that have been notified and sent to a cardiologist. So basically you have too many false positives. So you send too many people to a cardiologist, although there is really no the reason for doing that. Now the cardiologist might not even know anything about this tool, and he might decide to do an angiography when it's not necessary. Besides that, it's not nice for the patient, but it's also cost a lot of money. So that's another issue. Going further, diagnostic trust and competence, which is really is very much what Behrens and colleague was mentioning. using a black box algorithm like this one here might impair the trust of the doctor in the diagnostic app, especially if the function of the app is not being verified by independent studies, which was actually the case because when they started to sell this tool at the beginning, there was no publication, no peer-reviewed publication available. And so basically, how would the doctor would build up trust on something that has no evidence? You see, and this is not only this case. There are hundreds of products out there where there is no publication available. So there is not an evidence, and even if there is an evidence, as you said before, this might not be any more updated to the constant version of the tool. And here is another one that, again, was mentioned by Grote. Using an AI-assisted diagnostic app could, in the long term, impair the diagnostic competence of the medical personnel, and also the quality of the diagnostic process, where more physician assistants instead of medical doctors do the diagnostic groundwork. You delegate. Oh, well, I have this tool. It's interesting because when you delegate, you forget. Remember the time where the pocket calculator would not exist. You need to do all the calculation by heart. 127 times 25, or 275 divided by 17. Okay, now you can simply do 127 divided by 17, and you put it in the pocket calculator or whatever, and it does it for you. And you might forget how to do division, because division, of all the four, are the most difficult one. Now, if you forget about doing a division, it's slightly different than if you get to do a medical diagnosis, because you've always been relying on this tool, and that day the tool wasn't working, or you forgot it some other place. So there's a problem. Or the other way around, the doctor diagnosis decision might become biased because the doctor assumes that the eye is always good. Or the eye and the doctor don't agree. And there's a very nice example in Thomas Grote and Behrens' paper, where basically when they do not agree, they need to escalate it to a level of skillful experts that need to agree on the agreement. What is very interesting that if you refer to machine learning, you have bias in healthcare, machine learning bias in healthcare. There's a nice paper by Alvin Achtermark that is basically a cooperation of researchers of Google with the Chicago University Hospital, and they look at what does it mean bias in healthcare. Well, bias is the model design, so it's a tool. Maybe the labels were wrong, or the cohort where the data was used for training was using the data was wrong, or bias in the training data. So there's something wrong in the data that you've been training your tool. And that's now a surprise. So basically, if you design and train wrong, you expect that the output is wrong. But what is very interesting, there is a bias with the interaction of the tool with the stakeholders. So they mention bias in interaction with clinicians, domain specific. They have a category called automation bias, feedback loops, dismissal bias, allocation discrepancy. I don't have time to go in detail, but this is posing a possible bias with the clinician, exactly as we discover in our tool, or with the patient. Now, this is making the things very interesting because, let's say, a typical question that we have, which we couldn't classify as an ethical issue, that was a flag. So this is an example of a flag. The other one were ethical issues. We call it issue, not even call it tension. And so I like to give you an example of how would you go from this ethical issues into a verification. So suppose at a certain point, the question was, is that fair? This tool is accurate for everybody? So you should verify the tension, assuming that one of the issues that we have listed map into the tension accuracy versus fairness, which is really the case here, because the tool was trained using patients from specific location. In fact, 3 hospitals in one region. But the product has been sold in several geography in the world where the ethnicity is very different. Now, since by data protection, there is no information of who were this patient, but we know the location of the hospital where this was performed. The question is always, is this tool accurate for everybody and is fair? Because it could be very accurate for Caucasian people, but somehow it's not fair because it doesn't seem to be accurate for other ethnicity. So if you want to go deep down in there, the first question is, in which classes of product you are? Do you have access to the model, the data, the people, the designer, or you're in a black box? Because it's very different. First of all, you need to develop a sound medical evidence. We did it. Then we have the IP. In our case, we have access to the box, but the IP was protecting the box. So in order to go deeper into the box, we have to agree with the company, some of us, and not even all of us, to sign a non-disclosure. Now, the interesting byproduct of that by having a subset of an investigation team signing an NDA and the rest do not sign an NDA because they don't belong to the same organization, poses an interesting communication problem within the team and the outside, because you cannot disclose within your team all the information that you have. But without that, you cannot use tools to verify some accuracy. So we created a path and executed. And here I just don't show what we did with this company, but I take a general framework just to tell you the process. So suppose that this path is supposed to assess the fairness of this box. The first thing to do is to understand what fairness means. So, because fairness can be defined in ethical space in various ways. So which one is the definition you want to use? Once you have defined that, you'll see in a moment, then we need to identify the gaps and mapping the conceptual concept between context-relevant ethical values of fairness, in domain-specific metrics in healthcare, and finally, deep down, if necessary, into the machine learning classifier. So these are 1, 2, 3, and then go back, because at the end, the decision is always made at a higher level. You see what I mean about the level of abstraction here? If you're here, you're a machine learning engineer that talks about equity, metrics, but here you're talking about bias with doctors and not bias of the data. And here you're talking about fairness in a principle of anchor in some of the ethical theory. So for example, in philosophy, and I'm not a philosopher, but everybody that is in the audience will agree with me that there is not an exact definition of fairness, because it really depends on the ethical theory that you anchor with, and also different on if it's focused on individual, on the collective, and it depends on the context. And most of the time, if we agree on that, requires something that is not technical at all. So once you have defined your relevant ethical context, then you can decide what definition you wish. So for example, in healthcare, you can decide what is fair for patient and take in different concepts, like, an egalitarian concept of fairness, assess if the algorithm would use equal outcomes for all users. Please notice that, because you will find it in machine learning metrics. Or all relevant subgroups. Here is already a problem. What is a relevant subgroups is not defined. You see, even within this definition, this is ambiguous. Or if you take a minimax concept of fairness, ensure the algorithm will result in the best outcome for the worst of user group. So it's funny, because as you see, depending on where you are, what your motivation, that you might end up being here and here, and you have a theory that justify, but at the end, this definition of fairness is a completely different definition in practice. For example, suppose that you take, like they suggest, one possible approach is to use distributive justice. That comes from philosophy and social science, which I think also Thomas mentioned in his papers, as an option for machine learning. Now, this is interesting because they define that. You could define another approach, and then you try to move it to fairness criteria that can be measured in machine learning. Some of the fairness criteria they come up are these three here: equal outcomes, equal performance, equal allocation. But then I showed this slide to a philosopher, and he said, but why are you not using this Kaldor-Hicks criteria? I had to say, at that point, when he told me Kaldor-Hicks criteria, and said, I have no idea what it is, and I check it, and apparently this is a criteria that is used in welfare economics and managerial economics to argue that it is justifiable for society as a whole to make some worse off if this means a greater gain for others. And I said, okay, interesting. Maybe that's the way they build airports. Likely that's the motivation. The greater good is probably doing something, and it's actually the opposite of the definition of fairness that we saw before. So a consensus has to be reached. Otherwise, you cannot even start digging. Once we have that, suppose that we use the fairness criteria as defined in the previous slide, not this one here, but the previous one, then the question that you can ask yourself, do we have protected groups? So what is a protected group? It's a group of people that might suffer discrimination if the algorithm or the AI is not accurate enough. So in our case, question was, what could be a protected groups? We have a sample of around 700 patients from 3 hospitals in one region, in one country. And we don't know the ethnicity of these people. We know the age, we know a few other things, but we don't know where they come from. But the tool is being sold in various regions of the world. So protected groups, since the location of the 3 hospital was in Central Europe, and very likely older people, because there were people who had an angiography done. Otherwise, they couldn't measure the performance. So there were people that had the problem, cardiology, a cardiovascular problem, and then they have to measure that. So it could be non-Caucasian people, for example. So a protected group would be like Latino or Asian, Afro-American, or anybody that is not Caucasian. And the question is, you can then start asking the question like in this paper here, and said, does the model produce equal outcomes? Now, when you have that, you have to turn into something that has a meaning in the domain. So do both the protected group, maybe the Caucasian, and the non-protected group, all the other, benefit similarly from the model, equal benefit. If it's not accurate for the non-conjugation, the answer is no. Is there any outcome disparity lesson? So equalize outcome. It's doing the other way around. It's improving. Very unlikely. So, and then you have a bunch of possible questions, like, does the model produce equal performance? Is the model equally accurate for the patient in the protected and non-protected groups? This is what is really one of the key things that leads to a measure. If, for example, and you can see here, when you start reading that, you go from a higher level of fairness into something that can be measured in machine learning. So equal sensitivity, almost called equal opportunity, meaning a higher false positive rate might be harmful, leading to unnecessary invasive intervention and geography. So the question is, you need to say, okay, well, there's a confusion matrix. We know what is a false positive and the false negative. But what about when the tool receives data from patients that have a different ethnicity as the one that they've been trained? Because, the confusion matrix that you have is on the one of the data that they use. You see, and then you have other questions that come from this possible matrix: equal sensitivity and specificity, lower positive prediction value in the protected group than in the non-protected group, might lead to clinicians to consider such prediction less informative for them and act on them less. Alert fatigue, I think, is the one that Thomas was referring. And you can continue like that, because there's, for example, this one here: does the model produce equal allocation? Demographic parity is called in machine learning. Are resources proportionally allocated to patients in the protected groups? You go to an hospital and then certain kind of patient receive a better treatment than others. There's a catch about that all of these criteria that you have here, you have to measure it. Now, in order to measure that, you need to have access to the model and the data. Otherwise, there's no way you can measure them. So we have an interesting situation that we were able to access the model and the data, but most of the tools that were available for measuring those require an implementation that was not done by this system. So, meaning that basically all the tools that are out there in the market that would be able to help us to measure that were not applicable. So this is really interesting thing that sometimes we like to measure as engineers, but sometimes it's not possible because you can't measure, or technically there are problems to measure, or maybe the measures are not accurate. So, and you see, when you go down to machine learning, and if there are experts in machine learning here, there's a great paper here by Axel Beutel and colleagues, where they really look at the specific machine learning metrics in various categories, in models, and they have a classification. And you can actually see in the community of machine learning, there's a lot of work where they measure a lot of those. But remember, all of these are measured, and interesting when you do that, and there's a bunch of tools. It's for example, in our course, one of the lectures will explain some of these tools. Todo is doing a lab using some of these tools. But the interesting thing is when you measure something, sometimes you might not trust what you're measuring. That's very interesting. And this is, again, from this paper. You might not trust the data for training, but you might not even trust the people. Negative legacy means you don't trust the people. Or you don't trust the human raters, so the labeling is not done properly. For me, that means, what about trusting the whole ecosystem? And they actually mentioned that this is all very related to the context, cannot be answered technically. So you see, here you will need to start a path, which is validating how trustful is the environment where this is coming from. And it goes very quickly to go to not only trusting the data and the people, but trusting the entire platform, or trusting even the values of the entire platform. So you see, it can difficult to stop. And known that all of these fairness criteria are incompatible. So you can't have them all. So there are known trade-offs in the literature. So it's not that you can achieve everything. So there are trade-off within the trade-off to be made. And that requires not only the machine learning people, but also the clinical, ethical reasoning, the politician, and people need to understand what they are making decisions. So for us, that was a moment of reflection and say, okay, what are we learning here? First of all, we learned that at the beginning, we started assessing, and we didn't have enough experts in the domain. And so we added experts in medical public health and cardiologists. And we were thinking that's easy, then they can do an evidence base. And then we discovered that public health and cardiologists are different things. They're in different spaces. You know, public health normally goes on evidence-based medicine. Cardiologists are very specialized, and they don't even agree among themselves, not our people, but in general, in the literature, who is supposed to provide evidence-based. So there's even an interesting discussion within the domain of what is evidence-based. And there are a couple of questions that we're still figuring out, you know, how much of the inspection is questioning and negotiating, how much of the inspection can be done by software tools, and what is not possible. And a couple of things that we need to take into account, that we need to make sure that if we do something wrong, this doesn't backfire on whoever company or product. So this is a well-known problem, because you don't want to, you know, try to assess something and do something inaccurate or false and create a harm to the company or to the institution. So lesson learned, a lot of them, there is a lot of communication that needs also with the company or with whoever provides the assessment, especially to agree on what to publish and what not to publish, and that requires a constant communication. And at the end, the whole idea of the assessment is to come up with helping people make decisions, like doing appropriate trade-off. Is that appropriate to use it? Or maybe they should improve it, or there's something wrong, how to redress. Now, I like to stop here. I have more slides, so you'll see them in online when we put the presentation line. But I like to spend at least the last 5 minutes to answer the talk, because otherwise, you know, it does not talk. So if anybody has more questions, then I'm happy to answer some of the questions. I can go maybe back in the chat. Okay, let's see. A couple of thanks, which is always nice to have. There's a question for Maciej Mroz that was done in the first part. How about one more factor, more high level, perhaps, that is assessing whether the solution as a whole is ethical, surveillance system, autonomous weapon, is that a part of the tension assessment? I assume that more high levels refers to what we call macro. So, and the answer is yes. I think it is important to see the consequence of the use of an AI at the higher level. Otherwise, you are restricting yourself to a local space, we call the micro thing, and you don't really understand the implication. Or in the future, when there will be, you know, accountability, who is accountable? Who is responsible? Something goes wrong. So, for example, self-driving car is a good example. Something goes wrong. Who is accountable? The vendors of the car, the manufacturers of the software, the institution that allow the car to drive on the road, and it's important to see the entire ecosystem as a whole. Let's see. Elena Jones asks, would a benchmark test for the positive scoring scale be informative, or would it go against the spirit of the assessment? Oh, that would be very, very important. We wish we had the opportunity to do that. A positive scoring benchmark would be very nice because you could then compare. I think it's quite difficult. It's quite a challenge. You know, I think it is in the spirit of the assessment, but it's not something that will happen very soon, I think. Okay, there's a question for, well, the name is Piaka Vassini, but I think it is a short for two names. But he said, what happens if a protected group is not recognized at the time of the construction of the AI because there is no classification of that group? For example, suppose a new disease is discovered. All previous cases belong to that disease are incorrectly recognized as another disease. Does this automatically create discrimination, or am I wrong? In this case, it is a discrimination that is in the course of the production of AI might be unknown to researcher for scientific reason. Well, there are several questions in there. The first question is, what happens if protected group is not recognized at the time of the construction of the AI? This is basically ethical awareness. We figured out that the developers of this product have absolutely no idea about ethical principle. They are not bad people, not necessarily, only that they were machine learning engineers. So I don't think they even knew the word protected group. So when they design, and this is not the case, but when engineers which have not been trained in ethical reasoning design something, they design with something in mind, and then you discover whether they're protected groups or not only afterwards. So that, I think, is what happened basically in our case. Your case, the second question is very interesting because it says, suppose a new disease is discovered. Well, this is probably in the case of cardiovascular disease, probably this would be, suppose there is a new reasoning for creating a case for cardiovascular disease that was not known before. Obviously, the way they do is they train the system with new data, with new people. They might catch up that later on. So that would be the benefit of improving the system and the model, but you cannot compare. So again, and then there will be no evidence. So again, the issue of trust will be the same as before. So it's an ongoing process, and this is really one of the things that are making the things extremely difficult. Maybe I take the last question. So let's see, is yeah. Okay, so there is a question at the very beginning, by the way, from Elena Jones, that said, in academia and in your IPS, a large machine learning conference, asked for a broader impact section for getting a self-assessment statement of ethics. This seems like a conflict of interest, since it is a self-assessment. How might the inspection be deployed for assessing ethics of academic work, especially given the large volume of papers that are published every week in the AI field? Thank you, Elena. We are not assessing the ethical space of literature. We obviously use it for evidence. So it's like a chicken and egg problem, because at a certain point, only if we are able to consider the evidence that has been published ethically correct and up to date, we can base our assessment. So I think, yeah, you're right. I mean, this is also something that we didn't think about it, but it's quite relevant. So thank you. I would say, unless there is no any burning desire for the last question, I would like to thank you for your interest and your participation. And with that, we basically finish with this lecture here. And I wish you a great day. And tomorrow we will have the next lecture will look at the legal aspects of the implication of AI, which is very important. Nobody has talked about legal aspect until now. So I'm very happy that we have one of our actually co-designer of inspection that will do an introductory lecture on what are the legal implications of AI and ethics. Thank you for your attention and talk to you tomorrow. Bye.